February is American Heart Month, and hospitals and many organizations are raising awareness about cardiovascular disease and stroke. We are joined now by Dr. Denise Sorrentino. She's from the Iowa Heart Center. You have been on the air with us many times in the past. Thanks for coming back.
My pleasure.
Let's talk about heart disease and the impact it has on Americans.
Yeah. So, cardiovascular disease, which is heart disease and stroke, remain the #1 killer for all Americans, men and women. During the pandemic year, so much focus was placed on what was going on appropriately with that a lot of people kind of let that fall to the backside and weren't paying attention as much to their heart health. So we are really here in February of 2023 to hit that reset button and really refocus on taking care of ourselves, heart health, and heart disease. February 3rd, which is this Friday, the first Friday in February, is Wear Red Day. Back in 2004, it was called Red Dress Day for women's heart awareness, but now the focus has been on everybody, not just women, so it's Wear Red for men and women to increase awareness of heart disease.
And I love that today you went head to toe, rocking the red. It's perfect. It is a valid point, though, to talk about the differences in men and women in terms of how we experience heart disease and symptoms that come along with heart disease and stroke. So just outline that for people.
Yeah, so I always call it the Hollywood heart attack. You know, over the course of time, people watch movies and shows where it shows a man often sweating in an emergency room clutching his chest. And that really diverts a lot of attention to half the people with heart disease who are women. Women often have different symptoms: severe fatigue, aching in the shoulders, even abdominal pain, jaw discomfort can be signs or symptoms of heart disease for the female patient. It's not always typical, and certainly rarely is what I would call the Hollywood heart attack. So really being aware of symptoms is so critical for our female patients and our mothers, sisters, wives, and friends.
Absolutely, and because I think we have a propensity to experience symptoms, no matter what they may be, and think, oh, I'm fine, it's nothing.
Yes, that's absolutely true. Be evaluated is always what I say. We are caretakers and providers for children, spouses, senior family members, and neighbors. But if we don't take care of ourselves as the women in the households, then we can't take care of anyone else. So it really is to put that priority on taking care of ourselves, knowing our numbers, blood pressure, cholesterol, blood sugar, family history, and trying to keep on target with all of that, because prevention really is the key.
Yeah, so you mentioned risk factors, and of course, what we bring to the table genetically is part of that. So outline, what things do we need to be aware of in terms of family history, and then just the characteristics that we're bringing to the table as well.
Yeah, so family history is important, especially if there's a first-degree relative, which is parent, brother, or sister, who's had early heart disease, which is either a male family member below the age of 45 or a female family member below the age of 55. I always tell my patients, though, remember, genetics is one thing, but there's something else called epigenetics, which is all the things we do in our environment that can make our risk less. Not smoking, keeping our weight in the healthy range, keeping blood pressure in the healthy range, and really making those great choices about what we choose to eat, and then keeping active. And again, I think that a lot of people have put activity, taking care of that regular, at least 5 days a week, 20 minutes a day activity, have put that on the back burner. And I think this month, February 1st, is a time to say, let's start doing it.
Yeah, and to remind ourselves, you know, our heart is a muscle. We need to work it just like we do the other muscles in our body.
Absolutely true. Absolutely the truth.
Okay, get out there and get a little huffy puffy. That's the message.
Yes, absolutely.
All right, where should people go for more information if they want to learn more, if they're concerned?
Sure. So there's great information on American Heart Association's website. The National Heart, Lung, and Blood Institute also supports the Wear Red Day. A lot of information there. I want to point out that please, not only taking care of yourself, we have a big initiative this year to learn CPR.
Yes.
There's virtual ways that you could go on either of those websites to learn CPR that would help people that you would encounter or your loved ones if they were to have an event. And certainly Iowa Heart Center has a website with a lot of information on it for heart health.
Okay, Dr. Sorrentino, thank you so much. We appreciate your time.
My pleasure. Thank you.
Valuable information. Janae